Good morning. This is David Henry. I'm the communications manager for the City of Amarillo. I want to welcome everyone to our weekly Zoom news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We have some new panelists. Let me go ahead and introduce them. We are joined today by Mayor Pro Tem Howard Smith, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Todd Bell, who's Deputy Health Director, Texas State University Health Sciences Center. We're joined by Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. At this time, we're going to go ahead and turn over to our panelists, and then we'll take some direct questions from our media. Let's go ahead and start with Mayor Pro Tem Howard Smith. Howard, how are you this morning?
I'm good. Good morning.
Good morning.
As Mayor Pro Tem, I'm filling in for the mayor who could not be here today. Purpose of this meeting is to get the latest information on the COVID-19. And we've got the panelists that can answer a lot of questions. I've been watching these Zoom meetings for several months. And the thing I think about most is I've always been in favor of transparency. I don't know how a city can get more transparent than what we're doing today and what we've done over the last few months. We've got the leaders of each of the hospitals and the health directors to explain all this, what's going on. I want to remind people what I've been hearing from doctors for several months is we need to wear a mask. I wear a mask anytime I'm out. I'm not now, so you can hear me better. And to wash our hands frequently and to maintain social distancing. So those three things is what we need to keep in mind. So welcome panelists, and I'll turn it back over to Dave.
Thank you, Howard. Glad to have you. This time, let's go to Public Health Director, Casey Stoughton. Casey, how are you?
I'm good, thank you. Good to be with everyone this morning. We'll run through the numbers real quick. As of today, as of yesterday, there are a total of 4,618 cases of COVID-19 reported in Potter and Randall counties, 3,263 in Potter County and 1,355 in Randall County. We have a total of 3,866 recoveries and 56 deaths reported in our community. That leaves us with 696 active cases. Each of the cases do represent a unique individual. Over the last few days, the number of deaths that were reported increased the total number of COVID deaths by 10 for the past week. The deaths were related to a couple of issues. One was a report, a delay based on a reporting system, a cluster of deaths related to a single facility, and then a couple of unrelated deaths. We're heartbroken for each of the families, and public health is honored to work with each of the families and the friends during contact investigations. We do want to continue to encourage providers to report all COVID testing to public health and to counsel their patients to stay home while awaiting test results, and to stay home when the test results are positive. The public health team remains diligent in working with patients on contact investigation. Instead of one or two large outbreaks, we continue to see many smaller clusters, indicating that we're moving about and that we do have community spread here in our community. Clusters resulting from family gatherings, workplaces, youth and adult sporting events, religious events, and childcare facilities are some of the types of clusters that we're seeing. Currently, we are seeing cases in all age groups, but the younger age groups are where we're seeing the largest increase. We're still in the season where prevention is the most important factor. Like Mayor Pro Tem Smith said, wearing a mask, staying 6 feet from others, good hand washing, and limiting those social groups remains critical in preventing COVID-19 for yourselves and your loved ones. The public health drive-through remains operational. You can call 378-6300 and our staff will direct you to the test site. Since March 27th, when we started the COVID-19 testing in conjunction with Texas Tech, we've tested over 6,300 individuals. I think that's a really big win in our community. I do want to take just a moment to thank the staff at Public Health. They continue to do amazing work. I also want to brag for just a moment on our Public Health Authority system. Dr. Milton is our Public Health Authority and has done an amazing job since 2016. And he really has done an amazing job since March. We also have 4 deputy health authorities serving our community. Dr. Sherry Medford, Dr. Akko Bradford, Dr. Stephen Urban, and Dr. Todd Bell serve our community. You may have seen each of them in our recent mask campaign. We want to thank Dr. Bell, who is supporting public health while Dr. Milton is taking some much needed time away. So thank you, Dr. Bell, for helping us. And that's all I have today, Dave.
Thank you, Casey. At this time, let's now turn it over to Dr. Todd Bell, Deputy Health Director. Todd, how are you?
I'm doing good, and I appreciate the opportunity to be here. So I'm, again, just as an introduction, I'm an associate professor over at Texas Tech. Dr. Milton leaves big shoes to temporarily fill, but we'll do our best to do that. I would be remiss if I didn't again echo what Mayor Pro Tem has mentioned, and that is that importance of wearing a mask, that 6-foot social distancing, limiting our social contacts, and washing our hands. This is a community disease. It requires a community solution, and we have to have everybody in the community be part of that solution. And so if we're all doing our part, then that's going to be what stems the tide of this particular pandemic and outbreak. I appreciate the opportunity to be here and happy to help in any way I can.
Hey, we're glad to have you, Dr. Bell. Thank you for participating. This time, let's now go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you?
I'm doing well, thank you. Hey, good morning from Northwest. I've heard some debate about what we're experiencing in Texas. Is this a second wave of COVID? Is this a worsening of the first wave? Either way, what we're experiencing now feels very different from what we experienced in March, April, and May. So I heard a very clever analogy this morning from another doctor who said, back in March and April, it seemed like we had a bunch of campfires. There were focused areas of heat. And like we experienced here with the meat processing plants, with the penitentiary, what we're experiencing now appears to be more like a forest fire. Now, admittedly, we don't have a whole lot of trees in Amarillo, so a forest fire is probably not a good analogy, but this definitely feels like a grass fire, and since we are getting heat coming from every different direction. Now, with regard to our numbers, so we have 29 positives in Northwest right now. To remind you, July 1st, we had 7. Okay? What's different too is we have positives on multiple units. So we have positives on pediatrics, on labor and delivery, on our acute rehab. So we're seeing much more of a community involvement there. We have 13 patients in our intensive care unit, 8 of which are on ventilators right now. Again, July 1st, we had 1 on a ventilator. So much worse in terms of critical care. Right now, we're using 18 of our 40 ventilators in the hospital. So we still have some capacity there. As Casey mentioned, since July 1st, we have had, tragically, 3 people lose their lives due to COVID-19. And I would say really tragic deaths from this virus. One thing that's very different from a couple months ago is our staff involvement. Right now, we have 21 staff members quarantined at Northwest because of COVID-19. And we are getting 1 to 4 nurses testing positive every day over about the last week. Then when we do contact tracings, we're finding that these nurses are not getting this from the patients. They're getting it from family members, from community members, and from each other, actually. So again, all the more important is why we have to protect each other by wearing masks in the community, keeping the distance, and doing the hand hygiene. Right now, we've moved to where not only are we requiring masks of all our staff, but anyone in the clinical areas must also have eye cover, namely goggles or face shields in addition to their masks. With regard to visitation, because of the increased numbers, we are reducing our visitation. So we are going back to no more than one visitor in each room at any given time. And we're restricting those hours. So previously we were going from noon to 8 p.m. Now we're going 9 a.m. to 1 p.m. And the rationale for moving our visiting time to the morning is that's when doctors round. And so one of the frustrations of a lot of our families and patients was they didn't get to hear what the doctor was saying when they were making rounds. So we've moved our visitations to 9 to 1 p.m. so that visitor can be present when the doctors are rounding to hear the news about their loved one. We are currently not changing our elective procedure schedule. So we're continuing to do elective procedures and at this point don't see any plan to change that. With regard to remdesivir, the medicine that we are using for COVID patients, so we have 7 patients actively on remdesivir. We have treated a total of 55 patients since the beginning of the pandemic. And we have enough remdesivir to treat another 6 or 12 patients based on whether or not they need 10 or 5 days of treatment respectively. Finally, on Sunday, I received another call from South Texas for a patient to be transferred to us. That was our second one from South Texas. I did talk to a doctor in Lubbock a couple of days ago who said that they are receiving multiple calls from South Texas to transfer patients up to West Texas. So clearly South Texas is struggling right now with the capacity to take care of all the patients they have to take care of. So once again, we just ask people, please do what the mayor is saying, do what the mayor pro temp is saying, do what Dr. Bell and Dr. Milton are saying. Please wear masks, please keep the distance, please do the hand hygiene to protect our staff and to protect each other from this virus. That's all I have for the morning. Thank you.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, how are you?
I'm doing well. Thank you for letting me be a part of this committee today in this community announcement. You know, I think that our health leaders on the call have echoed some of the things that I wanted to just reiterate today, and that is that it's pretty obvious that we're in the midst of a second surge. You know, we had dropped off in terms of our inpatient volume after a peak in the mid 50s back in early May. And that gradual descent in terms of our inpatient census of COVID positive patients really kind of bottomed out around 10 or 12 patients several weeks ago. Unfortunately, back on July 1st, we had 18 COVID positive patients in-house, and that number today is up to 32. We had as high as 38 patients in-house earlier this week and on the weekend. We did have a significant bolus of discharges in the past day or two. So again, it's pretty obvious that across the state, numbers are going up. Our large cities are also seeing significant increases in hospitalizations. The death toll is rising, and we need to be very cognizant of the fact that if we continue to have significant surging in terms of COVID positive patients, we're going to tax the healthcare system. So what can we do? Obviously, wearing masks is at the forefront of this endeavor, washing hands, as Dr. Bell and Weis have reiterated, and also attempting to practice social distancing as much as possible and being considerate of others. I would like to add that of the 32 patients that we have in hospital today, 19 of those patients are in the ICU, 10 of those patients are on ventilators. And we're trying to use a conservative ventilator strategy so that we do not place patients on the vent unless it's absolutely necessary. We're attempting to use high flow nasal cannula oxygen, which has been shown to be a good supportive care prior to someone going on the ventilator. And sometimes it helps to stave off the ventilator. But when a patient needs to go on the vent, they need to go. And our critical care physicians and our hospitalists are making those difficult decisions when necessary. We are also struggling with a large number of employees that are requiring quarantine because of exposures. The overwhelming majority of our staff that's been quarantined and exposed have been community exposures. We've also had a number of employees since the outset of the pandemic that have been infected. Again, majority of those have been infections that have occurred in the community. And again, the majority of those individuals have recovered and are doing well. That is good news. What we'd like to do is continue to try to provide the safest environment possible for our staff. And therefore, we are going to augment our masking policy here at BSA, where even for a non-COVID patient, anyone who is front-facing is going to be placed in a KN95 mask. And that is a mask that is similar to an N95 mask, but is not manufactured in this country. Again, our first and foremost efforts are to protect staff, prevent quarantines, and allow us to continue to manage patients in our community that unfortunately become severely ill with this COVID-19 infection. I'd like to also add that we are to be restricting visitation again starting tomorrow. We've been kind of in this yellow zone, yellow range is a cautionary visitation mode, but because of the rising numbers in our community, we feel it's warranted to go back to no visitation. Now, no visitation does have some exceptions. For patients that are coming to our ER, we're allowing one visitor to stay with the patient in the room. For patients that are coming into day surgery, we're allowing one visitor. L&D, same situation. And then obviously those situations that are end of life care or when a surrogate is necessary for a pediatric patient or someone who has mental incapacities, we're permitting visitation in those settings. We will certainly continue to evaluate the ability to go back to a more liberal visitation policy as our community incidence allows. But again, our first and foremost effort there is to protect our staff, who is a critical set of human beings, physicians, nurses, therapists, et cetera, who are managing patients that come to our facility. Our ICU status right now is quite full. We also are using about 50% of our ventilators currently. And on that regard, we're in good shape. But we do have an ICU that is full, mostly from non-COVID patients. We are continuing to monitor our elective surgery schedule. And similar to what Dr. Weis said at Northwest, we are continuing with elective cases and only delaying cases that are able to be delayed when that determination is made by the physician caring for that patient who is doing a risk-benefit analysis of whether or not the surgery should be delayed. Otherwise, we are open for business. And certainly, it has been shown with our preoperative testing protocol that we continue to have a very small number of patients testing positively for COVID that are going through our preoperative testing process. And we've tested now almost 1,800 patients in that preoperative testing protocol. I think it's interesting to report also that similar to what Casey said regarding the testing done by the Public Health Department, BSA has done nearly 6,000 tests on patients since the outset of the pandemic. Most of those have been outpatient tests, obviously, and we've maintained about an 18% positivity rate out of those nearly 6,000 tests. So again, we at BSA, we appreciate all of our outstanding physicians, nurses, and helpers that are helping us manage our patients that are non-COVID in addition to COVID. We will continue to do so. And we ask you to help us by wearing a mask when you're out in public and attempt to be a good neighbor for the rest of the citizens of Amarillo. Thank you.
Thank you, Dr. Lamanteer. This time, let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I am doing well. Good morning, and thank you for this opportunity. First, I'll go to our numbers. Right now, we do not have any COVID patients in-house. We do have 24 COVID patients that we are monitoring that are home on self-quarantine. We do not have any PUIs or anyone we're waiting for test results to come back that we've tested. Do want to say we still have those 19 recoveries of people that tested positive and passed and have since recovered. Here at the Amarillo VA, we did do our resuming of our routine appointments at about a 25% capacity this week. And those seem to be going very well. And I know I've heard from countless staff members how happy they are to see the veterans coming back to the hospital for routine appointments. Some things I always like to remind is we continue to have our no visitor or limited access here on campus. Obviously, we have similar exceptions as were talked about before, but when we have a caregiver or situations, we do allow some exceptions, but we are not allowing visitors to our inpatients. Want to just remind the same thing that I think every panel member said is practicing those safe habits, the wearing your face mask, good hand washing, and social distancing. Yesterday, we got to celebrate, although virtually, the 90th anniversary of the VA. And so that was a great milestone. And part of that is I just want to thank our VA staff and what they are doing. We have Amarillo VA staff here at the hospital responding to our patients, but just want to say is we also have Amarillo VA staff that have volunteered to go to other VA facilities in South Texas, mainly San Antonio, but also some others, to assist them in their response as they are seeing a much larger impact in their communities. And with that, I'd like to continue to thank the Mayor Pro Tem and Mayor Nelson also for this opportunity in the City of Amarillo.
Thank you, Dr. Gonzalez. This time, let's now go to City Manager Jared Miller. Mr. Miller, how are you?
I'm good. Thanks, Dave. I want to remind everyone, as Casey said, excuse me, that the drive-through testing center remains open. If you feel sick, you have symptoms you think might be COVID, call the public health hotline at 378-6300. You'll be screened for the drive-through testing center. The location of the testing center is moved to a city-owned building in downtown Amarillo. Directions to the location are going to be provided to you when you call the hotline to be screened. Currently, we are under Governor's Executive Orders GA-28, GA-29. I want to give a real high-level just overview, just to remind everyone what criteria apply under GA-28 and GA-29 from the governor. GA-28 superseded GA-26. It's going to continue until modified or until the governor does something different. There's no occupancy limits. In other words, 100% capacity allowed in essential critical infrastructure, religious services, local government operations, child care services, youth camps, and recreational sports programs for youth and adults. There's a 50% occupancy limit on outdoor areas, events, or establishments for professional or collegiate sporting events, amusement parks, swimming pools, water parks, museums, zoos, rodeos and equestrian events, things like that. Also, every business establishment shall operate at no more than 50% capacity in the following highlighted areas. Restaurants are at 50% capacity and their patios are not called out separately in GA-28, unlike some of the previous orders. Bars are closed effective on June 26th. They can continue to provide takeout delivery of food, alcoholic beverages, as authorized by TABC. Rafting and tubing services are closed. I know that doesn't really apply to us at all. Finally, on GA-29, it's a standalone executive order from the governor relating to the use of face coverings. It became effective on July 3rd. Per GA-29, every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when they're in an outdoor space wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. The face covering requirement does not apply to the following situations. Any person younger than 10 years of age, any person with a medical or disability that prevents wearing a face covering, any person while the person is consuming food or drink or is seated at a restaurant to eat or drink, any person while the person is exercising outdoors or engaging in physical activity outdoors and maintaining safe distance from other people not in the same household, any person while the person is driving alone or with passengers who are part of the same household as the driver, any person obtaining a service that requires a temporary removal of the face covering for security purposes, like looking at a Face ID on your phone or something like that to make a payment. Any person while the person is swimming in a pool, lake, or similar body of water, any person participating in voting. But again, wearing a face covering is strongly encouraged when voting. Any person who is actively providing or obtaining access to religious service, again, wearing a face covering is still strongly encouraged in those settings. And finally, any person while the person is giving a speech for a broadcast or to an audience. Not accepted from the face covering requirement is any person attending a protest or demonstration involving more than 10 people. Finally, I would also remind everyone that the police department and public health and the fire marshals are enforcing the governor's order. To date, we have not had anybody fail to comply with the governor's order, so we have not issued any citations at this time, but we are continuing to enforce the governor's order. That's all I have, Dave.
Thank you, Jared. At this time, we're now going to turn it over to questions from our media. We have a question for an individual panel member or the panel as a whole. That's perfectly fine. Let's go ahead and start with David Gay of Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question is regarding, over the past few weeks, there's been a lot of discussion about reopening schools and school safety. I guess, can you tell me a little bit about, from the hospital perspective, from a public health perspective, what you believe school districts need to do to help prevent spread of COVID-19, and what measures you think need to be taken, and maybe as well conversations that have been had between public health and area school districts here about that topic?
So, I always say Amarillo is the best place to live because we're small enough that we have lots of resources, but we're big enough to have lots of resources, but we're small enough that we have relationships with all of the key players. And so we have had those conversations and ongoing conversations with our school officials. In fact, we meet every couple of weeks to talk about different things. TEA and other organizations have certainly put out guidance and recommendations and requirements for school opening. And so the schools are working through those pieces, all of the same things that apply. The prevention tips don't change. So masking, social distancing, good hand washing, those things still apply. And so we certainly are working with the school districts to make sure that that those situations are safe. Dr. Bell, did you want to add anything?
So I guess, first of all, I would just reiterate the same thing, that the fundamentals are the same regardless of wherever you're physically located. If you're in a school or a museum or a rodeo arena, the fundamentals remain the same, and that's the masking, social distancing, hand washing. I think that there's a lot still we're learning about this virus, and not just from a biology standpoint, but from an epidemiology standpoint as well. I think there's a lot of unanswered questions. And so with that, then I think that for the community at large, myself included as a parent, I've got to be flexible. This school year will undoubtedly look different than most school years do. And so we're all going to need to be flexible and be able to share a little grace with our colleagues in the education field, as they're also struggling to be able to put together the best, safest way to be able to help take care of our kids and educate our kids and be able to meet those educational goals. And so we continue to work with the folks in the education field. I don't know that we have any set in stone answers at this point, because it is something that remains a work in progress from a knowledge acquisition standpoint.
David, I would just say that I'm glad I don't have to make that decision about the schools. What I would say is, there's been a lot of sentiment that kids overall weather this storm better than adults. But that's the problem, is from the hospital perspective, I'm more worried about the adults in these children's lives, namely their teachers, their parents who may be staff members at BSA or Northwest Texas. And that's my concern, is that these kids may be asymptomatic in their spread of this virus. And then it's the adults that will be the ones who become symptomatic and maybe even critically ill. So I say selfishly, we're worried about the adults, and namely our staff members and the parents and the teachers in the community.
Absolutely. Absolutely. Thank you for your answer. And the last question I have is there any update on the convalescent plasma treatment in the area, if the area needs more convalescent plasma donations or anything like that?
This is Dr. Lamanteer. I can say that we still are in that high 20s to low 30s volume in terms of patients that have received convalescent plasma. I think, as always, we would encourage blood donations, not only during the time of the COVID pandemic, but throughout the year. It is an outstanding service and donation that you can provide that can save someone's life. It is safe to donate blood, and we encourage that. As far as the data on what the overall outcome is on convalescent plasma and that trial, it'll be interesting to see what the more largely powered study demonstrates. I think it's too premature for us to make any conclusions there. The bulk of our patients have done well that have received it, but again, this is a small fraction of what's been done across the country.
Absolutely. That's all the questions I have. Have a good rest of your week, guys.
Thank you, David. At this time, let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you?
Pretty good. How are y'all?
Good, good.
Yesterday during the city council meeting, Casey, you mentioned that there is a daycare type business that had a positive case. Is it just one, or is there multiple cases connected with that facility?
I think right now we just have one, and we have reached out to all of the parents that might be, all of the families that are associated with that.
All righty, thank you. And for the hospitals, you was talking about a number of staff testing positive and being quarantined. Are we in a position at this point because of that where staffing might become an issue, or are we still not there yet?
I can start off. Go ahead, Brian.
All right, thanks. So it's already an issue. So yes, we in fact, the Regional Advisory Council, the RAC, which is kind of the federal or the state organization that helps us in emergency preparedness, does have a grouping of nurses that we are now tapping into to help staff our hospitals. So we actually have brought in a number of visiting nurses from the RAC who are now helping us only on COVID patients. So these nurses can only take care of COVID patients either on the floor or in the ICU. So yes, we are getting to the point where we are struggling with staffing a bit.
Yeah, I would say that, again, the staffing concerns are real. No question that based on the number of nurses that we have that have been requiring quarantine, it certainly has put us in a difficult spot on certain days where we've had to do some creative maneuvers with our nursing leaders to get units staffed. Excuse me. With that being said, we are okay right now. We have not had to use outside sources. I'm quite interested in moving forward with some modifications to our return to work protocol. The CDC released some guidelines last week that I think is going to permit us to have some more flexibility regarding how we do so for previously infected workers. But the bulk of our workers that are quarantined are not because of infection, it's because of potential exposure and us being cautious. So the question is, allowing them back to work in a time frame that is reasonable when the majority of those individuals are not going to be infected.
All righty, thank you very much. And Northwest said that you've taken in 2 patients from South Texas. Are they both from the Rio Grande Valley?
I'm sorry, just to clarify, we've taken in 1 from the Rio Grande Valley. We got a second call this weekend from Beaumont, but we were not able to accommodate that patient at the time.
Okay. And BSA, have you been contacted about taking in patients also?
Yesterday, we had our first request to take a patient from South Texas, from the Corpus Christi area. Unfortunately, we had to decline accepting that patient because we did not have the ICU capacity based upon where we were and what our anticipated admissions were going to be to the ICU over the next 6 to 12 hours. So again, it was not a situation that we could accommodate. Similar to what Dr. Weis said, I think this unfortunately is going to be a situation where we're going to potentially continue to have those requests.
All righty, I think that has been covered. Thank you.
Thank you, Aaron. This time, let's now go to, if I'm not mistaken, Vanaya Patino of the KFDA News Channel 10. Am I correct?
Hey, David, it's Vania. But yeah, I respond to anything at this point. Thank you.
I'm sorry, forgive me.
No, you're good. Thank you, everyone, for your time. Casey, at the beginning of the presser, you mentioned the delay in reported deaths came from an outbreak. Is this the nursing home outbreak you guys had mentioned in the previous presser?
Yes, some of the deaths were a result from a nursing home, and we have been working with the nursing home. All of the families have been the nursing home is working with all of the families and the loved ones, the residents there in the nursing home, and are being very, very helpful.
Got it. Thank you. Also, given the national reports of people not answering phone calls for tracing, is that the case locally? And if so, what is the response to that?
So anytime, I mean, there's always a, contact information is always tough. Sometimes people move, sometimes people have different phone numbers. And so public health always makes multiple attempts when trying to reach people. So even if we're not able to get somebody via telephone, we send letters, we send certified mail, we send regular letters. So we try really hard to get in touch with people. If we have the hospital information that we get is really helpful because it will have emergency contact information. And so we reach out to emergency contacts if we're unable to get a hold of the patient. And so we really try hard to get a hold of people. If we can't, then we really try hard. So we send multiple letters, we make multiple attempts, but yes, sometimes that does happen.
Got it. And then another question regarding contact tracing. Are younger people who test positive, I guess, more challenging to work with, or have you noticed any patterns with the contact tracing?
I don't know that necessarily based on age. I think, our nurses are very good at building rapport very quickly. And so it's an art to do contact tracing and contact investigation because you develop that rapport very quickly and developing trust in that conversation very quickly. And then as the conversation develops, then generally we try to garner that trust. And as during this pandemic, we as a society, we know that contact tracing is occurring. And so we do rely on that knowledge that the health department is doing contact tracing so that we can receive that information from individuals. But yes, there are times when people don't want to provide information, and we just really try to work with them so that they understand that it's important. No one's in trouble. We just want to make sure that people stay safe.
Thank you, Casey. My last question, maybe Mr. Miller, you could answer this. We've been getting, calls and comments saying that people are receiving some kind of notice that they've tested positive when they've never, even gone to go get a test. Is this possibly a new scam, or have you guys heard anything about something like this?
Not heard anything. We've not heard anything about anything like that that's legitimate. Based on what you described, it definitely sounds like a scam of some kind. I will check with the police department to see if we've had any reports like that. This is the first I've heard of it, but it definitely sounds like a scam of some kind because I'm not aware of anything legitimate that would be doing that.
Okay. All right. Thank you. That was all my questions. I appreciate y'all's time.
Yeah. This time, let's go to Roger Gray of KBI Channel 7. Roger, how are you?
Well, I'm good, but I didn't raise my hand. I think we're okay here.
Good. Go right ahead.
I don't think he has any questions.
I meant I have no questions.
You have no questions.
I didn't hit the raise hand sign. That's it.
Well, I just didn't want to leave you out.
All right. Thank you.
That was our last media member. This concludes our weekly Zoom news conference for this week. I want to thank all of our panelists who took the time to join us today. As usual, we appreciate you providing this valuable information to our community. Once again, we do this every Wednesday at 11 a.m. for the Zoom news conference for the latest in COVID-19 information. This is David Henry. I'm the communications manager for the City of Amarillo. We'll see everyone next week. Thank you.
Thank you.
Thank you, Dave.